Welcome to the Empower Group, a global organization with a mission to transform the way people learn, work, and save lives. We execute our mission by working through 3 centers and organizations: the Center for Leadership and Development, the Center for Digital Learning and Animation, and the Empower School of Health.
To date, we have delivered more than 1 million hours of training in over 100 countries to thousands of students in all areas of public health, such as disease management, immunization, antimicrobial resistance, supply chain management, regulatory affairs, access to medicines, and so on.
We implement these programs by partnering with organizations which include ministries of health, UN agencies, civil society organizations, and the private sector. We are transforming the approach of capacity building by moving away from expensive classroom-based training and introducing digital and blended learning. We design comprehensive and innovative learning strategies which include web-based trainings that are built on Empower's open source learning management solution. We design content that is customized to the learner's requirements, including micro-learning and content in local languages. And for more complex topics, we design content using virtual and augmented reality to provide a more immersive learning experience. Another unique feature built into our learning strategy is our adaptive assessment tool, which allows learners and managers to review their growth over time and also compare their outcome with peers in their own organization or even with peers from other countries. Finally, we like to make learning fun, and so we bring elements of animation and games into our content and learning designs.
And with this, we have the ambition of being able to reach much larger numbers of people, reaching all the actors of the primary care system, all the community workers at the last mile. This is how we can help transform systems of health and improve their performance. We have a great team, among them former chiefs of states, former ministers of health, former high-level diplomats, specialists in public health, in supply chain, in training, and of course, in information technology.
For more information, please visit our offices in Geneva, New York, New Delhi, Dakar, and Kathmandu. For more information, you can also contact us at www.empoweringmillions.org.
Greetings, my name is Francis Wango. I have had the singular opportunity to interact with Empower School of Health for over 2 decades now. And within this period, I have been opportuned to undertake to completion the postgraduate diploma, and I am now taking the Masters of Science in Global Health Procurement and Supply Chain Management course. Both of these courses have been career-defining moments in my life and in my career. The postgraduate diploma course was at the basis of my transition from a faith-based organization to an international non-governmental and humanitarian organization. The current master's course helped a lot in my evolution from a locally based staff to an internationally based staff. All of these progressions were due to my consistent interaction with Empower and the benefits of its webinars, short courses, and certifications. I have had the singular opportunity to share this knowledge with other mentees and students that have been opportuned to train and to mentor. I want to encourage each and everyone who is looking for quality, innovative, and cost-effective professional education and certification to not hesitate to reach out to Empower School of Health. They are available. Their dynamic team is ever willing and ready and always understanding in circumstances where adaptability is necessary. Please reach out to empower and be encouraged.
Good morning, everyone. Welcome. Can we just maybe take some few minutes and then waiting for the colleagues who are also trying to get in, and then we will have the intro after that. Just maybe for 4 or 5 minutes, then we'll take it from there.
Good morning. Good morning.
Good morning.
Good morning. How are you? I've been having a challenge with internet. I've been using all 3 devices, all 3 internet providers. Sorry for joining late. I was trying to join. The internet from all providers was just playing up. And we just want to thank you for taking your time to join in this webinar, which has been organized by the University of Zimbabwe Department of Laboratory Diagnostic and Investigative Sciences, Cape Peninsula University of Technology Department of Biomedical Sciences, Stellenbosch University Division of Chemical Pathology, and University of Collaboration with Africa Federation of Clinical Chemistry and Laboratory Medicine, and the African Consortium on Laboratory Systems Training. It is my pleasure to welcome you to this webinar, which is the target is on supply chain management in clinical laboratories. And I would like to thank our presenter for the day, Dr. Bettina Chalematsau, and also our moderator for the day, from this time. Thank you very much for attending. Over to you, Chaka.
Thanks very much, Dr. Machingura, and thanks also to the participants, our guests, who are the attendees as well, because we always cherish this time, knowing very well.
Have we lost Mr. Ndo?
Yeah,
I think I was busy trying to find to switch from one network, so we could have lost Chaka. It's the network which is playing, I think, all over. So we need to be patient. I'm also checking if so that we can continue whilst waiting for him to join. I'm also checking, is Giza Chow online? I don't. Sonia, do you want to run the information one before we have the presentation, or we have already run it?
Yeah, we already did.
We already did it. All right. So our presenter for today is Dr. Chale Matsau, who works at the University of Pretoria in South Africa. And I would kindly ask Bettina to share your slides. His title of the presentation is on supply chain management in clinical laboratories. As we are aware, supply chain is one of the key issues in the lab, and we really need to take care of the supply chain, and we really need to, so that at least in the labs we are able to control what we utilize in the lab and make the maximum use of the resources that are available to us. Over to you, Bettina.
Thank you very much for the introduction. Yeah, all right. Can you hear me? Can you hear me?
Yes, we can hear you.
Okay, thank you. Okay, thank you for the introduction. As Dr. has said already that I will be presenting on supply chain management. My focus will be mainly on clinical laboratories, and because it's a broad topic, I'm going to zoom in to focus on those areas that I personally feel is a challenge for clinical laboratories, including my own lab here. Let's see. Okay, just want to say I have no conflict of interest, and this is mainly for training purposes only. The outline of my talk is just that I'll firstly give a brief introduction and just try to describe features of supply chain and logistic management, looking into the commodities or supplies, if you may, and the challenges that impact delivery of service in clinical laboratories. And I will look into the strategies for effective procurement, and we'll look at how we can actually optimize logistics management information system. And as I have said, you will see throughout my talk, I'm going to really be looking into inventory management, because this is probably the problem not only for us here, but I think most clinical laboratories, especially in economies similar to our own here. And I'll also look at staff management, because for me personally, staff is one of the most important commodities. If you can manage your staff properly, you are guaranteed to receive good service regardless of what kind of setting that is. And therefore, we'll go into summary and conclusion. In today's fast-paced world, efficiency, accuracy, and reliability are the defining features of clinical laboratories. Those who work in large labs like my own, we realize that we have, over the years, had even more samples to test, as we see many requests from clinicians. And this therefore implies that we are literally on daily basis screening, diagnosing to help these patients to be managed. Apologies for the sound on the corridors. We also know that laboratory results account for about 70% of disease diagnosis, and this therefore places laboratory medicine at the center stage of patient management. This therefore is telling us that with all these results we are generating, we are certainly using a large number of consumables, and these consumables cost money. It's been estimated that about 15 to 40% of the lab budget actually goes to consumables, meaning that this is the money we cannot afford to waste. Demand for diagnostic has increased due to the rising number of diseases that we have since noted that there are more chronic diseases, there are many emerging conditions, especially infectious diseases. As you know now, on the continent, most countries, we are battling the mpox, and while this is still more localized to some of the centers, we can see that this kind of things can actually be a problem. Now, we need to have improvement in lab diagnostics, to have accurate, prompt results generated, and that are reliable. And for this, we need reliable equipment as well and reliable reagents. Therefore, when it comes to laboratory logistics, it means they have to be effective, because we want to have efficient service delivery. This therefore has put a lot of pressure on laboratories to say that actually we need to up our game in terms of supply chain management. Supply chain management is a broad topic. It has a lot of role players. Lab needs to ensure that we have equipment that are necessary and agents and staff that are going to make sure that this is done properly. The results are generated quickly so we can give amicable service to our clients. Thus, a well-managed supply chain is needed for reliable service. And many of us can agree that this is the area we're still struggling in. Supply chain management, as I said, is a system that involves planning, coordinating, controlling of material and equipment to ensure sustainable service. It actually includes sourcing. Some of you have heard me give a talk previously on procurement. We have logistics management, inventory is also in there. So it's a big component. Now, for us to be able to do things right, so we can save money and provide good and reliable service, we need good quality supplies. And this includes reagents, include equipment. And these reagents must actually be stored in such a way that it is reliable. We can count on these reagents being still usable when stored. And what I'm saying is that when reagents come, there are indications on how these reagents should be stored. And these should be very clear for us so that we can actually store them appropriately. Therefore, these role players in supply chain management, when they come to the party, the purpose is to ensure that the customer, and in our case, are the clinicians and patients. Therefore, clinical laboratories have to ensure that we have available material with minimal cost, or basically when we procure, we must make sure that we don't waste money, and we also are able to obtain these at reliable suppliers. Also, the waste we generate, we must be able to manage, but waste can actually be, some of the waste that we generate can actually be avoided. We need to find ways to reduce disruptions and also to be able to effectively provide, we can jump the slide, yeah, to ensure compliance and regulation for all the parties. The lab has to provide regulation, comply to regulations, and so should be the suppliers, of course. Now, why is this important also? Remember that when we don't have communities, we don't have results for these patients that we're managing now. And if we don't have results, or we delay in providing these results, we're actually delaying the diagnosis. We may even miss the diagnosis. We may actually be accountable for some of these patients that are going to die because we could not give the results or we didn't give them on time. Therefore, we're compromising the patient's quality of life. And these, of course, lead to high healthcare costs. So it is not helping when we are unable to manage our own supplies. Therefore, an ideal supply management calls for effective laboratory logistics management. And what am I talking about? We are all familiar with requiring the right commodities to be in the right quantities, that should be in the right condition, delivered to the right place at the right time, and of course, at the right cost. All of these are achievable if we agree to do things right and we follow the status rules that we set to actually try to make sure that the process is effective. I just wanted to show you quickly the components of supply chain management. And all of these, you can appreciate that we need to be able to select the product that we want to use. All of this must be done properly. We need to be able to procure decently, as I've already described how procurement is done, especially in public service, because I work with a public lab, and how we need to manage the inventory properly so that all of these lead to effective service delivery. And all of these are important to ensure that the process is run in such a way that there's minimal disruption. What are these commodities that I keep referring to? We have reagents. In some instances, this come in the form of kits. And in these kits or agents that I'm referring to, they can either be chemicals or they can be biological agents that we use for detecting a lot of analytes. We also have consumables. And what are consumables? These are actually material that we need to run the lab, like the bleach that we use, the gloves that we actually have. And the durables, these are those items that we use multiple times, like pipettes or various equipments, or even our analyzers, we can actually throw them in there. But as you will see, that most of my talk will focus on reagents, as I've indicated that this is a challenge for many of us, including the lab in which I work. But the challenges that are facing laboratories, clinical laboratories, include frequent reagent stock out. I don't think there is a month where we do not have some kind of one of the many reagents, because we do a lot of tests in our lab where we're not threatened by one of the reagents being stock out. In some instances, we're able to get the supplier to provide us with surplus quickly, but this is a very common thing. But other things include equipment downtime, breakdown, especially when your equipment is a bit old. This is one of the challenges. Sometimes equipment can actually get angry as it arrives, and this can also really lead to questioning how the procurement was done. There are also situations whereby we may not have adequate equipment or material. And this is very common, especially in resource-limited countries. I'll just give an example here. One of the benches that we have in our lab is an electrophoresis bench. As you guys know, electrophoresis can do a lot of tests. So in our setting, we have just one equipment. And for this, we have to do beta-2 transferrin. It's an urgent test. When this test is requested, everything stops to make sure this is done so we can actually save that patient. We have LIPE, is it also an urgent test? The SPEP, which is the protein electrophoresis, and the from serum as well as the urine, these are not urgent, but they're also very important tests. But what I'm trying to tell you is that all of these tests cannot be run at the same time. So when we have one test that is required more than the other, some of these have to wait. We also have sudden load changes. I see it as very cruel for the supplier to suddenly say, oh, by the way, our load has changed. We see a lot. Even now, as I talk to you, we have a situation whereby the supplier has provided one of their agents as a brand new lot. That should not be the case. The supplier should actually notify the lab in time so that the lab has a time to do the lot-to-lot changes, because that is good laboratory practice. You don't just jump to a new lot. And also, my observation, not all staff members are knowledgeable about lab supplies. It is not uncommon in our lab to hear someone saying, oh, we've run out of reagent A, or we've run out of a control. When everyone knows or is familiar with the process, then all of these would be identified early. And another issue that we have is the customer complaints. This is very common amongst many labs, but also this has to be kept to minimum. Because when all of these things that I've described to you keep on occurring, obviously the employees that are on the floor and managing the instruments, that's where we run to say, guys, things are not working. What are you not doing right? And by doing that, some of the employees may be despondent, and when they're discouraged, they're going to make more errors. When they make more errors, this is actually becoming more like a ripple effect, whereby we are now unable to even provide a reliable service or appreciable service. I call this substandard service. We cannot afford to do that, because patients that come or utilize our laboratory are those patients who don't have a choice. We are a public service, so you have to do things properly. We took a vow to look after patients in public, and we have to do exactly that. Now, the challenges of supply chain management in clinical laboratories, including procurement. I've already alluded to some of these, that the procurement may be such that it was not really, the process wasn't being done properly, the product quality was questionable, the time of delivery was a bit of a problem. I have seen an instrument that was procured and placed, and it took 2 years for the lab to go live with this instrument. And that is questioning the quality of the instrument that was received at the time. But other issues that most labs have, this could be international really concern, because even first world countries also complain of limited financial resources. But this is because laboratory business is a very expensive business. Inventory management is one of the big problems, and this is where I personally have a big gripe, because when we cannot manage inventory, that means we can't manage groceries. So this is, for me, a big problem. Storage conditions, shelf life, accessibility of these. In some centers, you may find that the lab does not have adequate space for storage of all their material. So some of these may actually be stored at a different site. In other labs, they may actually even ask for a third party. In our setting, most of our reagents are here, but there are those that we use a common stores. It still belongs to our organization. It just happens to be at a different site. For example, ethanol. If we have run out of ethanol, 95% ethanol in our lab, and the technologists are working in the middle of the night, that can actually be a problem to access the ethanol, because it's actually housed about 1 kilometer or so away. And in the middle of the night, we can expect technologies to actually walk that distance. Even if someone is available to help at the stores, it will be difficult for us to expect that. Other things we are unable to manage is waste. We waste a lot of money. Human error is one of those that is very common. Obviously, in many instances, we use pen and paper, so mistakes are done. There are also mistakes in ordering, incorrect inventory counts. They have the indication that we have 4 boxes of controls left. Meanwhile, this was not done properly. We don't have 4 boxes. We're only left with 2, because probably another lab was had to borrow a box, or we didn't count properly in the first place how we were using them. Errors in data entry, and also illegible writing. So these are some of the issues that we have. But these are not the only problems we have when it comes to supply chain management issues, including the regulatory hurdles and compliance. Really navigating the challenges of local, national, and international regulations, especially depending on where the suppliers are. This can actually be a big problem. Non-compliance with these regulations can be a big problem, because the orders can be cancelled. This can actually lead to legal complications, including fines and litigations. It is not uncommon in our setting to have the supplier telling us that, oh, that order is coming, but the shipment is still on its way, is still coming, or we have port issues. These are the things that you want your supplier to already be able to sort this thing out in time, so that when the ordering is done, things are done quickly and amicably. Now, let's talk about the strategies for effective procurement. When we choose a vendor or a supplier, we need to do homework. We need to ensure that we have discussed the requirements of the lab with the supplier, and how these suppliers respond will actually provide us with clues about their commitment. In other words, when we are looking, and that most of the time in our setting, it is not really done by the laboratory. The homework is done by the supply chain manager. So they will be able to do adequate homework, but in communication with us, because we have to provide them with indication of what we really need. We call this identifying the need. But we are also responsible for actually looking into the website. You can look into the reviews of this supply. You can communicate with other labs. That's what I personally do. I talk to other pathologists across the country to find out what are their issues or experience with a specific supplier, because that actually helps to guide you to make a decision whether this is the supplier that you really want to have a relationship with. Because indeed, when you purchase any commodity from a supplier, in our setting, it's like a relationship. You're building this relationship so that you should be able to communicate with these people constantly, so long as these people are your supplier. So there has to be reliability. They must be professional. The quality of their products must be reliable. We want ethical business. They must be sincere. You can't afford to have a supplier that's coming on board only to find that their finances are not in order, only to find that they are actually at risk of being liquidated. The cost-benefit analysis is also important. It should be done before even making a procurement decision. And this is important because when you do that, you're not only looking at the upfront cost of the lab, but you're looking at the long-term benefits. Because while we may want to save money, we cannot afford to buy equipment or reagents that are substandard and are not going to help us. It's important to have durable and easy to use material. I remember Prof. Andy at one time presenting, saying, the laboratories will struggle when they procure rubbish. And when he was giving this talk, he was talking about the instrument that we will receive. We find that the instrument is not, the moment it lands, it's not user-friendly, or we don't even have the skills to use it. And when it's broken, it is difficult to have it serviced. So most labs will have piles and piles of equipment that are actually not repaired. They sit in there in gather jars for many years because some part is missing, or they are still trying to figure out how to get this equipment to be sorted. And we also struggle with the issue of waste disposal. We find that the equipment is sitting there, and as you know, that you're not going to throw some equipment in the dustbin. There has to be proper ways of disposing this. We are struggling with all of these. Now, doing things properly will ensure that we make a decision. It's actually an informed decision. Once the vendor or supplier has been decided upon, it doesn't end there. We continuously assess the supplier, because that is going to help you to decide whether this is the person or the company that I would want to see still providing service in our lab. So they are continuously assessed. You constantly review their performance. Are they easily available when we need them? Are they meeting those needs that we have already described? Are they accessible when we want to give orders, when we want to do top-ups? Are they giving us excuses, or are they saying, yes, we will do that, we'll come to the party? And I can tell you now that we are in the middle of the crisis now in our lab, and our lab, I'm referring to the entire NHLS, and we've been doing manual ordering. When we contact your supplier, you don't want them to say, oh, you know what, I need you to first wait for the purchase order. We are in a state where we need a supplier to say, based on our relationship, you say you don't have reagent A, I'm bringing reagent A this afternoon. Some of tests we run are urgent. We cannot afford to have the supplier saying, I'll be there the next morning. We want, when we say we need something, it has to happen. After they've called us up, they have to make a plan to make sure that they help us with that. And this should be based on the relationship that is built with the supplier. Anyone who is unable to help in that regard, that supplier can no longer be part of your family, because they're not meeting the needs, which I have indicated earlier, that our primary goal in our setting is to make sure that we save lives. We took the oath for that. And this way we will avoid disruptions and also unnecessary losses. Product selection, I've already mentioned a little bit on that the specifications have to be very clear. They must be understood by the team in the lab. They must be understood by the supplier who are going to read the specification. We don't want any surprises. We also need to be very clear how the preparation of the reagent should be. Should it be liquid? Should it be powder? Because preparing these can actually be different. The shelf life is also important. It is very frustrating to receive reagent and to find that, oh, you know what, this actually, I have bought 4 boxes, but I see that the expiry date is actually soon. We don't want that. In chemistry, we can have expiry date of about 6 months or so. If it's a high volume test, that is not a problem. If you are going to have a test whereby you have very few that are done in a month, you're at risk of losses. So you have a decision to control how much you are actually purchasing, or to even outsource that test to another. It can be a sister lab, even another sister lab is doing it. What's also important when procuring the product is to ensure that it's compatible with the instrument. As you know, we have open and closed system instrument. The open system instrument is that instrument that says, you know what, I don't care whatever reagents that you get from any supplier, I am happy to run it for you. Closed system, it's actually not working like that. Here you have the supplier, the manufacturer basically says, I am only using reagents that are coming from us, for example. Or they can have a situation where they say, you know what, we have trusted supplier. So you can use ours, we are manufacturer A, but you're also able to use reagent from manufacturer B or maybe C. But please, if you use anyone else, this will be a problem. So now during product selection, if this was not taken into consideration, we will have test controls that are failing forever, results that are not making sense because this was not done properly. Location of the manufacturer is also very important, as I've already indicated. There are lots of reasons for this, including transportation, including the regulations that are actually linked to this. I told you that at some point would be told that, oh, you know what, your agents have arrived, but we have port issues. We don't want to hear anything like that. When we want the agents to arrive, the relationships must be such that all of these things have already been ironed out. Another thing that is important that I think I mentioned with the manufacturer is you want the manufacturer who's reliable. They should be ethical how they conduct their business. They should be sincere with their financial spending. You can't afford to have excuses while you're already in the middle of a contract, let me put it that way. Quantification. We need to be able to have the quantities we need, and this should actually be indicated upfront that we will have that. Now, it is also our responsibility to make sure that when we quantify what we actually need, it is done in such a way that we're not going to be left with a deficit. It is also important that when the commodities are being procured, it is important to ensure that the shipping schedules of the reagents that are linked to ETERs are actually coordinated. It's not going to help us to say, oh, you know what, we have received reagents for this, to test in this another. The controls are also there, but we won't be able to run because we're still waiting for buffer, because the buffer is coming with another shipment. That is not going to help us because we're not going to be able to run the test. Also, when we are forecasting what we actually need, we have to do it in such a way that we do not forget to include also the material we need for controls, for example, the material we need for training, or also to kind of estimate the waste and loss that could actually happen. And this can actually be as a result of a potential break that sometimes reagent bottle can be broken in the lab, dropped and be broken, or it can actually be as a result of waste that we could not avoid. For example, let me just give you one little example that's occurring in our lab now. We had a situation whereby we have controls for reagent A, control 1, 2, 3. Now, because of the troubleshooting that we needed, we have actually run out of level 1. Now we still have level 2 and level 3, and we want to open the next bottle or control and to find that, oh, actually now we're sitting with a different lot. This is a problem because there's no way you can take control 1 from a next lot and be able to use it for there. So these are some of the things that I find very frustrating when with regard to the effective management of supply. We also need to have flexibility in procurement to accommodate technological changes, test material quantities, volumes of reagents. Like some suppliers will provide, for example, the reagent or QC material at 100 mils, and they may decide that we're no longer going to provide this at 100 mil, we are now going to provide them at 50 mil, but they don't tell you this. So they, on the material count, you're like, oh my goodness, why I didn't order the small bottle? So no, we've actually moved, we're no longer providing the 100 mil. All of these can actually be a problem. But if they communicate this upfront with you, you are able to know how to navigate that, because some of these are actually linked to the cost. You may find that the supplier is actually moved to the 50 mil because they realize that if they are to give you the same 100 mil, it's actually expensive, because we know what's happening now in terms of the economy across the world. But all of these things have to be very clearly determined. We are also duty bound to make sure that we monitor the supply pipeline and update forecasting on a regular basis. Most people are saying quarterly. I say it depends on the challenges encountered. In our setting, we cannot afford to do it quarterly. We have to do it on a regular basis. Now, with regard to inventory that I said I'll spend a lot of time on, let's make sure I can skip any slide. Many labs are still doing their inventory management manually. Some labs will use a spreadsheet where they document stock loads and balances. Others will even say they use cards for each commodity. I know one of my colleagues has previously indicated that, you know what, color coding is actually an ideal, because in that way you're able to see the depletion when it occurs. Now, manual managing the inventory could work for a small lab, but for a big lab, it can actually be a problem, because there are already other features you need to do manually. But the last thing you need is to manage your stock manually. Others will say they assign different accounting persons for inventory management. So they'll schedule some kind of a roster, so to make sure that there's constantly someone in charge of that. And the information capturing obviously will be done, including the beginning of the balance, and when the staff arrive, then they'll update it, and they'll also try to estimate the losses and try to adjust that and be able to say, now this is what I checked, and indicate the closing balance and date and signature. Now, all this good and well. For small labs, it's good, but for tertiary labs like ours, this is a problem, a big problem. Therefore, we need to find a way to optimize supply chain management. The lab needs to have a robust and reliable inventory management system. This system, it will rely on historic data to estimate the consumption rates or patterns and be able to provide useful information so that we are never left with too little or too much of material. The system is so integrated across all departments such that procurement is done efficiently, orders are done quickly, and payment to suppliers is also done effortlessly. The capability to calculate stock levels and stock forecasting is also important. And this can also be done efficiently, and it actually calculates the reordering time points. And this can actually be different for different commodity supplies. So if we have slow moving, those that we did are not going to be finished quickly, as I've indicated. But if the agents are, for example, for UNE, we know that these are fast moving. But if we're looking at reagents for thyroid function test, for example, you may find that not every patient that is coming is going to need the thyroid function test. So ordering for UNE and LFT cannot be the same as you do for ALP or for beta-12, or any of those. Now, management of laboratory supply has been identified as a major gap. And therefore, it leads to interrupted service. For us to try to improve on this, we need to find a way to effectively manage the resources such that we don't find ourselves overstocking. Because most clinical labs do, those that don't run quickly into, I don't have stock, they actually find themselves really spending a lot of money. And this can actually be wasteful, because you're going to find yourself with a lot of expired reagents. And this they do with good intentions, because they're scared to avoid, they're trying to avoid shortfalls. So effective managing lab commodities is really challenging, because forecasting, inventory management, all of these can be a problem. And if this is done manually, it can really be a tedious process. Now, we need to have an efficient system. Efficient system is electronic in most ways because this can calculate for you, and it actually provides lasting solutions. So this is actually a computerized system. So all the lab need will be a computer hardware, and of course, many printers, but printers will be for, should you need to print something, but the actual process will be such that you have a software that is going to be reliable, that is upgradable, that is actually going to be aligned to the features that we want to capture on the laboratory management information system. You also want to have regular IT support. If I call IT person, we cannot afford to have a person who will say, you know what, I'm actually in another lab, in another town, so I'll see you guys in the afternoon or the next day. If they cannot help us on the phone or assist us virtually, because today we know that IT can actually work on your computer from any distant location, then they should be willing to physically come to the lab. We also need to have reliable electricity. Now, if you live in South Africa, you know that we've had many episodes of load shedding. Right now, we don't have that really, thank goodness. Now, we also need to have reliable backup power supply. We need to have the system that we know is keeping up with the trends of the technology changing. Right now, most of the spheres are AI-driven, and we need to be able to have a system that is amenable to that. At this point in time, there are so many of these softwares available. They really have competent prices. There is absolutely no reason for laboratories not to acquire this. It may be expensive at the beginning, but it's a cost that is worth considering because it really comes with long-term benefits. As I've said, stock hours is very common. Unpredictable workloads, you find that another lab has run out of reagents, or they have issues, maybe their equipment is down. Then they send you large numbers of patient samples. Now, this is actually messing your stock because the truth is you have accounted for your own and maybe added a 10%. Should there be a need for you to probably test additional samples if doctors are requesting more? But if you're going to your sister lab sending this patient to you, you're going to run at a risk of actually having your stock being depleted. Sudden request for reagent loan. And what is this? Sometimes a lab professional, manager, supervisor may say, you know what, we need to contact this sister lab to borrow this reagent. And they then take it with the idea to actually frustrate you, but the plan is trying to be able to deal with their sudden occurrence of a problem. But this can actually leave you with a bit of a depletion. And these are the things that we need to really be very aware of, because this can actually result in this lab that is lending now having a shortfall. And also the issue also will be the associated ordering of associated products. I've already indicated the issue of if a buffer is not ordered for an analyte, I already have all the reagents except for that one buffer. That can also be a problem. And also how we order is really a problem because different reagents have different needs. The reagents with short half-lives have got different needs compared to those with a longer shelf life. And another issue is the how early the reagents get depleted. There should be procedures in place to monitor and document movements of communities. And therefore, on receiving this, we need to verify that the product is received, check that it is the right type and the right quantity, and verify that the commodities that were requested, actually, if they were requiring cold chain, they were actually appropriately transported. We cannot have reagents that require cold chain, not to find that they were transported for 400 kilometers just in a truck that does not have any cold chain consideration. And when they get here, we say, oh no, this actually have to be kept in a fridge. If we're going to keep them at 2 or 4 degrees here, they should have been transported at 4 degrees. And all of this should be very clear when we receive them. We need to conduct a visual inspection to look at if there was any damage. This would actually be in transit, or if for some reason we're receiving the reagent and then suddenly we see that this expiry date is actually next week. We don't want to receive reagents like that. And store products according to specifications. Some products may require to be stored in a dry place. Some may need to be frozen. Some may even say the freezing should be such that it's at minus 70 degrees. All of this must be very clear. I've already indicated the issue of maintaining cold chain and how we store our chemicals. If reagents are flammables, they should be stored separately. And ideally, they should be stored such that we have a working fire extinguisher within reach. And when I say working, I mean this had to be regularly tested, because we don't have to be surprised when we want extinguisher to find that, oh, this thing has been standing here for 5 years, we have never needed it, and now we need it, it's not working. That cannot be the case. And any corrosives should also be stored separately. But these we would ideally want to store at the ground floor, for example. And we also have those reagents that light sensitive. So these would come in amber bottles, with those dark bottles. When these reagents come, we have to make sure we store them in dark cabinets. And we should not decant them to bottles that are not dark, because now we're going to deteriorate the reagents. And we need to update these stores regularly. Another thing that I want to mention here is that when we receive material, it is important to be able to realize that you want to finish the material that you already had first before you go to the older material. There's this first expiry, first out principle or practice. I have noticed many people that have, even in our lab, whereby when the material comes, they just go and grab the reagent that is available in front of them, instead of looking into utilizing the one that they have always had in the lab. This is not only the problem with the person that is grabbing this, but it also indicates that inventory management is a bit of a problem, because it doesn't make sense to store the old ones within reach. This should actually be basically furthest from those that we have to utilize first. I have already indicated the issue of visual inspection. This should be done routinely, because there could actually be damage that occurs while we already have the material here in the lab. This can occur as a result of water damage or tearing, or missing label, or probably with deterioration, or even expiry date. Now suddenly we are beyond expiry date. There's nothing as embarrassing as running the controls and the test fails, and you check and you find that, oh, actually the controls are actually expired. Also, chemical damage. Some reagents may change color, or have a sudden acquire a different color, or even if they are dry products, they may suddenly become cake-like in material. So these are the kind of things that we'll be able to see if we're doing our job properly. We should be able to estimate waste. Different tests are affected differently depending on the test volumes. I've already indicated that if our ordering is such that we have excess of one over the other, we may find that if the test is not used too much, we are going to end up with waste. If we're able to estimate this, we're able to avoid it. Labs should have established procedures for disposing unsuitable commodities, in other words, waste disposal. This would be damaged or expired commodities. And when these are removed from the storage, we have to update the stores, because we don't want to be surprised thinking that we still have enough while we really don't. Another element that I want to talk about that is, for me, probably the most important. I personally feel that when we do the right thing with staff, we will definitely conquer any obstacle that can be in front of us. Now, staff training is very important, and I feel all staff should be trained in logistic management. Each person utilizing lab communities should be trained in recording, reporting, ordering, inventory management, and storage. There shouldn't be an assigned person to say the lab supervisor is the one who's looking at this. Everyone should be familiar with how these things are done. There should be regular updates on new communities and changes in suppliers. If we are changing in suppliers, there mustn't be any technologies or technician that says, oh, I thought we were using this supplier. Everyone should literally be kept up with the pace of what is happening when it comes to supply chain management issues. I also recommend refresher courses and training to accommodate new staff, because you may find that we have new people that are coming. I wish that the laboratory training would include in the curriculum the supply chain management. I don't know if it is included at the technicons, but this is one thing that I really would recommend. Another element that I feel we need is supervision. It's like mandatory supervision, where supervisory visits are made to ensure that staff are performing tasks as expected, they are following procedures as outlined in the standard operating procedure. Because if you follow the SOP, SOP is like a recipe. You do something according to the recipe, there's no way your product will be different than that if done by another person. So we follow rules properly, who will be fine. Encouraging the accurate recording and reporting is very important. And also provide opportunities to staff to ask questions. Have an open door policy about suggestions for improvement or to raise any concerns. The truth is, while we may have lab management, it doesn't mean that people who are not directly designated lab management do not have ideas. So we give this platform, we may actually work in such a way that we improve the status of our lab and be efficient in how we do things. And the truth is, when staff are appreciated, they feel motivated. And when they are motivated, they will really do wonders. I believe that an efficient team will lead to satisfactory customer service. And I just want to mention a little bit about planning for the unplanned. This is the contingency plans that we would have, because there are certain things that, regardless what we do, we cannot avoid them happening. We have seen the natural disasters occurring, floods that were making difficult for the trucks to actually move about. Pandemics, we just came from one now. Supplier may actually be bankrupt. Labor strikes, that is really commonplace to many. Political tensions, we know there are wars going around now. IT downtime, potential interferences, including hacks. As I've said, we are in the middle of a crisis right now, but having a relationship with supplier can help that none of these natural supply and unexpected disruptions will be very harmful or be really resulting in this service coming to a standstill. This can negatively impact availability of commodities, and doing the right thing will make sure that we are able to progress. This is what we did also during COVID. Now, in summary and conclusions, efficient supply chain management is required because this is going to guarantee consistent available testing commodities for continuous medical lab service. We need to enable labs to provide patients with quality testing. And if we do this, we'll be able to provide the diagnosis that this patient needs, the very vow that I said we all took. We need to build our human capital. I cannot overemphasize this enough. We need to have staff that are skilled, that are reliable, that are effective, that are efficient, that are able to provide the results that are needed. We need to also be, as I've said, prepared, find a way to actually prepare the lab for should there be a disaster, as I've indicated some of these in the previous slides. In my opinion, all medical laboratory professionals and scientists must have training certification in supply chain management before they even assume responsibility. This can be also informal training in supply chain management. I feel that if the University of Technology can include this in the training, this is going to make a difference. Even when we have scientists who came, someone who comes from, let's say, Bachelor of Science directly, and we acquire this person who's going to work in a lab, if this was not included in the curriculum, we need to ensure that informal training is done. And because we're going to do refresher courses and mandatory supervision, anyone who's coming without a formal training is not going to miss out on the training in supply chain management. I also recommend periodic assessment of laboratories by the quality officer to check that there's compliance, to really have a checklist on zero expiries. No lab should have this large number of reagents that have been thrown away because they're expired. That's a waste of money or wasting public resources. And stock out should be a sin. We should be able to calculate to see how much of the communities we need. Equipment downtime also, I feel this is also one of those that can be avoided, but the truth is some equipment may actually be, the instrument can actually be old. So sometimes it is difficult to avoid this completely, but when we do maintenance properly, we do the procurement properly, there's no way we're going to end up in an instrument that is breaking every single day, like we see with some of the labs. And these can actually be, the non-conformance can actually be given. And, you know, when you get this kind of grading, it actually helps the lab to up the game. And this can actually be discussed during management review to actually guide the lab to improve so that as time goes, the labs are actually coming to function effectively to provide the very needed service. Thank you so much for your attention. I really appreciate your time. Thank you.
Thank you very much, Dr. Chalema Tsao, for that great presentation, and it was comprehensive. I will hand over to our moderator, Chakando. Whilst Chaka is unmuting his mic, please, if there are any questions, feel free to type on the chat box, or also raise your hand so that we may be able to deliberate on this important topic. As we are aware, in the lab,
He says it's
we
muted.
need the resources.
He says it's muted. Chaka says it's muted, I think.
All right. They are working on unmuting Chaka's mic. That's fine. As soon as he's unmuted, you take over. All right. Just to indicate that we have in the lab, we need not to take it for granted that we have the resources that we use in the lab. And if not managed properly, as Dr. Chalema Tsao was indicating, we won't be able to provide the service that we are supposed to provide. And hence, it to cause a disruption to the service per se. And hence, in some labs, you find that it's the lab professional who does the supply chain management, or they work with the procurement specialist. And in either way that you are involved in the supply chain management in your lab, the personnel in the lab needs to know what they want, and also to have planning in place in terms of what you want, when you want it, and also ensure that you have controls, as was indicated in the presentation, that your stock management, your ways of ensuring that you control what you are using, so that you are able to forecast what you can use per se. I'm just looking in the chat box whilst waiting for Chaka to be unmuted to see if there is any question that we can address.
I think there's a hand raised. Dr. Machingura?
Yes, I can see. I can see a hand raised. All right. Can you please unmute Alex Haba and also Chaka Ndo so that we can hear their question or their contribution. We are free to add or contribute.
Hello.
Yes.
How are you?
You can go ahead. Yes, you can go ahead.
I'm Alexi. I am to Guinea.
Yes,
I'm
go ahead.
I'm great for the formation today.
Yes, go
Hello?
ahead. We are hearing you.
I say I'm great for the formation today. But I don't speak very well English. I speak French. I speak English small. If you can traduce the course in French. Hello?
Yes, we can hear you. That we can also be able to engage our colleagues in the Francophone. And this is in line with our vision of the consortium. We note that we are not all English speaking in Africa, and there are others who are in the Francophone part, and efforts are underway to also engage other colleagues in the Francophone, and so that at least we can have some of our webinars being held in French to allow inclusivity. Thank you for that great contribution. Thank you. We will definitely include that.
Okay. Thank you.
Thank you very much. Chaka, you can unmute.
Thanks, Dr. Machingura. Yes, thanks, colleagues.
Right.
And
any further question?
Can you hear me now?
Yes.
Okay. No, thanks very much. There is a question.
Chaka.
There is a question which I thought maybe we could also ask Dr. Matsao, who did a wonderful job for the presentation. Also, maybe some contribution from Prof. Erasmus. The question comes from Thomas Dove, where he's saying, is there any strategic, it's about the strategic effectiveness of strategic procurement in choosing vendor supplier if it is appropriate to follow or bidding process as such. Dr. Matsao, you indicated that there are one of the things which we need to have is to have a good strategic planning as such, or a system, so to say, for the supply chain as well as inventory management. So I think Thomas is asking if there is a specific one for the procurement which you can think can work for choosing the vendor or a supplier. Maybe in 1 minute. I know, colleagues, we are now running out of time. Dr. Matsao?
Yes, thank you. Thanks for that question. Yes, but remember that when it comes to procurement, you are guided by regulations. Now, that being the case, when, in our case, in the context of NHLS, which is my employer, when we are procuring, we are required to submit any commodity for bidding if it's more than R1 million. In other words, you cannot have an outright purchase on anything that's more than R1 million. You can request you can request the suppliers to actually give you proposals, but definitely you have to bid for that. If what you want to buy is less than that, then you're able to actually go for outright purchase. This is what I usually do. If we have, for example, used a previous supplier, I want to give an example now what we did in our lab with the procuring for osmolality. We were struggling with this with these people, and what we ended up doing, we got the supplier to provide us with material. Right now, if you have you've used the same supplier before, you are able to kind of go ahead and purchase a new instrument, especially if it's not expensive. Another is the reagents. Another one is when the supplier is the sole supplier, like the supplier for electrophoresis. We don't have so many. So in those cases, you know that even if it's going to go for bidding, you're just going to have this one supplier bidding because there isn't any other. But remember that you also have other features of procurement whereby you will need emergency procurement, and that is regardless of the price. So bidding in our case is mandated for any commodity that is more than R1 million, even service, even if you're going to acquire, let's say, a cleaning service. If they require more than R1 million, you are going to have to do bidding. I hope that answers your question.
Thanks, Dr. Matsao. Maybe in conclusion, Prof. Erasmus, if there is any comment, and then maybe Dr. Gazejao, your contribution, then we will take it from there. After that, we'll ask Dr. Machingura to close.
I'm not seeing Prof. Erasmus online at the moment. Maybe he is in them, unless they are using another name. I don't see them online. So yeah, you can allow one question. Then
I was about to say that. I saw a question on what I think, if I may go ahead, Chaka, if you don't mind. Someone asked about the how do you suppose should be the vendor we spoke about. I'm trying to see that question where this person was talking about the management of the supply chain. I just want to emphasize the importance of ensuring that every personnel in the lab is familiar with how things are done. Because if everyone else is doing things right, there is no way that the lab, look, we will have problems, but we can control them. Another entity that I want to mention is a question that was raised regarding how much waste do you think, is there a value that we can attach to waste? There isn't. We shouldn't have waste, but obviously we cannot avoid it. So we want it to be minimal. So I would say less than 3% is a big number. And I'm saying 3% deliberately because I know that even with our rejection rates, the 3% is a magic number. We don't want any waste. We don't want any rejection, but we waste a lot of money. I did a study on potassium. When you have time, you can go and have a look at it. The article is online. I did a study on, if you don't mind, Chuck, I won't be long. I did a study on potassium rejections. I found that within a year, we at NHLS and this lab where I work, we have actually lost almost 1 million of the samples that were rejected or results that were removed because those results were not suitable to be released to the clinician. The potassium of 9 in a sample that's grossly hemolyzed or the sample that is being trapped in logistics for transportation for about 4 days, there's no way that potassium is out of that patient. So I always say, remove that, don't confuse the clinician. But the truth is, we're removing that at the cost of the lab, but we need to save lives. Our role is to protect those that we took a vow to say we will protect. Thanks. I don't know if you want me to answer another question, but I'm happy to do that.
I'm not Prof. Erasmus is online, but we're not aware the name is using. And there's a hand from Thomas Dove. Yes, Thomas Dove, you can go ahead. You can unmute and.
Yeah. Am I there? Hello?
Yes, I can hear you, Thomas.
Yes, you're online.
All right. Thank you. Thank you. I want to extend my. You getting me right?
Yes, we do get you.
Okay. I want to be thankful to that for the opportunity. I'm a Liberian from Liberia, and I'm residing in Saudi Arabia. I hail from a procurement background, but I think the short time her lecture was very excellent, and I enjoy it so much. I wish that we could have a network of such that will continue to impact us and build us up, because I learned a whole lot from her, and especially with her presentation. I little bit want to get a little clarity when she spoke about emergency procurement. Now, I want to know whether in the aspect of emergency procurement, you can follow the normal procurement process where there is an emergency procurement to do the process of competitive bidding and stuff, and inviting vendors to that bidding, open bidding process. Thank you all so much.
Thank you, Thomas, for that question. No, when we are in an emergency, as you've seen during COVID, we don't have time to do competitive bidding. Time is money. We are at the point where we are trying to solve the problem quickly. So we don't do that. Emergency procurement gives you permission. In other words, at that point, you're not even looking at that 1 million rand I have indicated. We're looking at the resources that are needed, that are going to be used to make sure that we get the answers quickly. A typical example was the PCR analyzer that we saw that was needed across the world. We know that many of the labs were struggling to acquire that because it was really highly sought after, because at the time, it was the only mechanism by which we could definitely say the patient has got COVID-19. So no, when in emergency procurement, we're looking at what is needed. And also remember that we also have the specialized procurement, whereby it may not necessarily be an emergency, but you may find that this supplier is providing a unique asset. Therefore, in that way, also the direct procurement from the supplier is also allowed. Thanks, Thomas.
Thanks, Dr. Matsao. Prof. Erasmus, any comment? So if Prof. Erasmus is unable to unmute or to contribute for now,
I don't see.
Dr. Machingora, you wanted to say something? Colleagues, I can see that the network
Yeah, you
is
can
not.
go ahead. It's all right. I just am saying we're not noting the username using Catsi on the.
Okay, no, that's fine. There was a question which I thought when you conclude, Dr. Machingura, maybe before you can look at it. It comes from one of our participants. I realized that it was not answered. I think his name is. It's not Hubert, it's Charles Matemba, who had two questions. The one was about what would you recommend for addressing the challenging issue of resources constraint you pointed out? So seemingly it's directed to Dr. Matsao. And then for the supply chain performance metrics, what would you suggest are acceptable wastage rates, if there are any? Maybe in 2 or a minute, Dr. Matsao. Then after that, Dr. Machingura, you can close. And once more, colleagues, thanks very much for this moment. And thanks for the participants, Sonia and the team. Thanks very much. Colleagues, always remember, as Dr. Machingura on his intro highlighted, we need to participate. We are trying to empower ourselves on aspects which affect our daily life as Africans. So as such, thanks very much on my closing remarks. But Dr. Machingura, you can also conclude. Thanks.
Dr. Matsao, you can go ahead before I conclude.
Okay, great. Thank you. Yes, the second question I already answered. I don't believe there's a specific level of wastage that we should actually consider. We should actually be working on minimal waste. We should try to avoid waste as much as possible. However, because we know that it's not really practical, I said, in my opinion, anything less than 3% would be acceptable. With regard to the resource constraints, most of us, we have serious resource constraints. But I can tell you now that if we were managing our resources properly, that waste would have been able to avoid. I'll give you another little example now. We have been printing the results now in our lab, and we're doing this across the entire country. And there are so many papers that I have seen shredded because these results were not accounted for. Now, there we have lost the ink that we needed because we need to print them, the cartridge that we use. Basically, the toner is finished very quickly. But we wasted the paper. We've wasted also the human resources. The person that's going to stand and shred these parts and parts of paper would be using this person differently. I'm just giving you examples of where we can minimize waste. If we can deal with waste, we'll be able to deal with the issues of resource and the constraints that are linked to the resource unavailability or limited. Another thing that I want to say is that when we procure, when we have substandard material that we have, that is actually going to lead to the issues regarding to contributing to what resource constraints. It's not going to help us to say to the clinicians, oh, we can't run that because we don't have money to buy these reagents. It doesn't work like that. Other people believe in using donor agencies. I find donor agencies very frustrating because remember, when I am your donor, you're actually depending on the goodness of my heart. But if you are self-reliant, you don't have to count on what I'm going to do for you. You are able to make sure that you use the little that you have, but efficiently, effectively. We are not doing that at all of us. Thank you.
Thank you very much to colleagues from Empower School of Health who were making sure that we are able to get online